generally speaking, is the evolving nature of COVID-19 in Nigeria, not just in Gombe State. It is showing the multifaceted nature of the issues around COVID-19, issues that have to do with social, economic, psychological, as well as medical, ramifications. What we witnessed today in Kodon and the FTH basically are issues around what Prof has just said. We've read about people even committing suicide because of COVID-19. So a lot of it is really, when you're put in isolation, you're separated from your family. And one belief that most of them have is the fact that they have been forced to stay on isolation while they are very healthy. Well, of course, nobody is saying that they are sick. They are asymptomatic carriers of the virus. And by implication, leaving them to reside within the community means encouraging transmission of the virus from one person to the next one, and that would be a recipe for igniting community transmission. And this is basically what we're trying to achieve in Gombe. The chairman has mentioned, the over 90 cases that we have recorded in Gombe State are all cases that were intercepted at the point of entry. And that is because of the very proactive nature and the very proactive approach, taken up by the task force of going on active case search. If we had just waited and stayed in our offices waiting for cases to come from the community, I don't think we would have the pleasure of what we are witnessing in Gombe now. Our communities are mostly safe because the few cases that would have come and settled within the communities have been intercepted. And these are the cases that we have taken to isolation facilities. And of course, nobody is saying we are perfect and we are able to provide 100% of the necessities of these people. There are challenges, and these issues are evolving. The first issue that the TVC reporter raised is about a lady requiring paracetamol. For God's sake, any person that is under control of a hospital, a facility, an FTH for that matter, is not allowed to go on self-prescription. Even if it is as ordinary as paracetamol, the doctor must prescribe. And we have a full list of procurements that we have done, for all the medications related to symptoms that are usually found in COVID-19 patients. And we have even gone beyond that we have given a matching order. If for any reason there is a comorbidity or there is a secondary symptom developed by any case under isolation, the doctor would give a prescription and the case management team would go to a pharmaceutical center and buy the additional medications, even if they are outside COVID-19 list of medications that we have. And so for a patient to tell you, for someone in isolation to tell you that they have to go and look for paracetamol, that is just an imagination. It doesn't work. We have drugs that are required for the management of COVID-19. And even outside those lists of drugs that we have, there is a system that procures directly from a retail center. And so I think that is just, they're trying to create sensationalism around the whole issue. Well, of course, feeding. You can imagine, I think even without any answer, for someone to tell you that the food that is being cooked, I don't know who cooks the food, I don't know who supplies the food, but how did they know that they are using white Maggi? Is it something that you see from the soup? I don't know whether you can see the color in the soup. So it's a lot of, allegations that people are kind of manufacturing to discredit the entire process of, in fact, the entire concept of COVID-19. To so many people, they think it's a scam. People think that we are just putting numbers together so that we can attract funding from the federal government. This is the unfortunate situation that we have all found ourselves here. And so it's not, I think it's a collective responsibility, not just of the task force, but the media, the members of the community, traditional as well as religious leaders. COVID-19 did not start from Nigeria. COVID-19 has gone around the entire world, and COVID-19 has killed many people and is still killing people. what is happening in Kano, I think should be an example to all of us that are here. If we are taking COVID-19 as something that we can joke with, well, let's just continue praying and watch what the consequences would be. We are not hoping for that. But one of the reasons why Kano has gone upside down is because they have not adopted the kind of approach that we are doing here in Gombe. We've been able to test. If we don't test, we wouldn't know the people that have COVID-19 in our communities. And Kano had left testing for a very long time. And what they have ended up with now is community transmission. Literally almost everyone around really has some kind of infection in Kano. And people are dying from all sorts of, directions. Nobody can even tell you the number of people that have died in Kano. And 90% of the cases that we diagnose here in Gombe are cases that came from Kano. So it's not a joking matter. But of course, we know there are psychological issues, there are social issues, as well as economic issues that are probably even beyond, the capacity of the task force. And we need to now kind of look at strategies that would be all-encompassing. The government is there. We are agents of the government. We're here representing the government and making sure that we do everything that is possible. And you can see even from the membership of the task force, it's a multi-stakeholder team. Look at people from the federal safety, from customs, from the university, from health, from all sort of, aspects. So it's becoming a multifaceted, a multi-stakeholder issue. In fact, it's cutting across the entire ramifications of the Nigerian economy. And this is exactly what is happening globally. So we'll continue to do our best. There is a special committee that has been established by the task force to take care of all the needs, the welfare needs of, all the cases of interest in those facilities. And that committee is chaired by the Honorable Commissioner, Ministry for Local Government. And to the best of our ability, they are doing everything possible to ensure that the needs of these occupants of isolation facilities are well taken care of. They can't be perfect. They are humans. And the issues are evolving. The classical example of what happened in Kodon today, I think the media even has a bigger responsibility than the task force. Because what happened, was a situation that a lady developed an injection abscess. And so it became very smelly to the extent that the occupants of the facility now complain that this woman must be moved out of the facility. We said, fine, we're going to move her. And we sent a team with an ambulance to evacuate her. And they barricaded the road, that they wouldn't even allow the ambulance to go into the facility. So how do you solve the problem? Do you bring military men to start shooting? Or do you bring policemen to do what? So we had to engage with them, and ultimately we were able to convince them, and then we agreed that the woman will be taken away along with two of her relatives. And the condition they gave was that they must not be taken to any hospital. We must return them to their community in Iliri. What is the implication of doing that? Take 3 confirmed cases back into Iliri community, so that we're going to implant the virus in the community? It doesn't make sense. So of course we agreed. And we evacuated them to Iliri. But of course, we're not going to take her home. And we called Maitangale, the DPO, and the medical officer to make contingency arrangement to receive them and see if we can isolate them, within Iliri General Hospital in a side room, pending when we sort the problem out. So these are issues that you can't predict. These are people mostly that are coming back from Lagos and Kano. People that have their eyes wide open, and they feel because they are asymptomatic, why are they being kept in isolation? So it's a kind of a social reaction which we all have to work around to solve this issue. So I think, Larry, as much as possible, thank you very much for raising the issue. But it's also important for us to also internally digest and then try to make sense out of a patient who is trying to do self-prescription while under the care of a medical officer or a health worker. That is unethical, is not allowed. Or when someone tells you that the food they are being given is below the standard that they expect. Last week when they sent that video, they were even celebrating. Look at the kind of food they are giving us, with big chicken, rice, and so on and so forth. These are, funding from the government. It's not a static thing, It's coming on and then going down. So when you have enough resources, you do the best that you can do. When the resources dwindle, you still continue to feed them. But there is no policy as at now that says the task force should shoulder responsibility of the families of those that are on isolation. If the government decides to bring that policy into focus, fine and good. And then we look for the resources to do that. But I don't think now it's a direct responsibility of the task force in Gombe, not even at the federal level where they have received billions of naira. To date, we have not seen a kobo of that in Gombe State. All that we're doing is managing with the little resources that the government of Gombe State has provided. And then, of course, the token contribution that is coming from other stakeholders locally. So it is a big battle for all of us, and we are all in it for a very long haul. Nobody knows the date that we're going to get over this. And the problems will continue to come, they will evolve. We will continue to also develop strategies to address them. I think that's the little that I can say on that.